For CPC purpose, you need to know what is the vessel that is being repaired and what is the type of graft that they have placed, whether it is open or whether it is endovascular, whether it is ruptured or whether it is non-ruptured or whether it is a dissecting aneurysm or not. While treating it, you should be knowing the type of graft, okay? Whether it is a unibody device, whether it is one limb or two docking limbs, or whether there is any placement of extension prosthesis. For example, here the physician is placing a graft and then he is placing with a one docking limb. So you will have to select a code accordingly, and here the physician is placing an extension device. Okay, so you will have to code for both the proximal extension and the distal extension separately. Is that clear? So just see, in the case of aorta, it can be a thoracic aortic aneurysm or a descending aortic aneurysm or a visceral aneurysm, or it could be any other artery like a splenic artery or iliac artery.